Dr. Espada, I heard you have a colic case. Are we ready to cut?
C. Tengo on colic.
Dr. Espada, you know I don't speak Spanish.
Lo siento. Yes, I do have a colic.
Are you ready to cut?
No. This patient is being treated medically for now.
So, what you are saying is that we are ready to go to surgery.
The gypsy vanner was brought in a grinder-up trailer.
Was the owner wearing a scrunchie? Or perhaps a Pirelli jacket?
Why yes. How did you know?
So we must be ready to cut this horse.
The horse is a 1-year-old gypsy vanner stallion that has been colicking since early this morning after his Pirelli training session.
I will prepare the surgical suite to take him to surgery.
We are going to medically manage him for now. Do you not understand what I'm saying, Dr. Davish?
No, I already told you, I do not speak Spanish.
On physical exam his heart rate was fast, like a hummingbird, at least 58 beats per minute, respiration rate was 36 breaths per minute, and temperature was normal.
That heart rate and respiration seem too high. We should cut now.
We passed an NG tube, and did not receive any net reflux back. Abdominocentesis was normal. Upon rectal palpation there was a firm mass felt in the left dorsal quadrant, and then my arm went numb.
I will call Silver Fox and let him know we are going to surgery.
Abdominal ultrasound showed dilated loops of small intestine.
So what you are saying is I should call the Canadian and Basley as well?
According to his owner, he currently eats coastal Bermuda hay, off the ground which is covered in sand, and free choice peppermints. He lives in a pasture, and has free access to pond water, which is covered in blue-green algae, and has a large population of snails.
So he has Pontiac horse fever? So, are you saying we are not going to cut?
That is what I have been trying to tell you, Dr. Davish.
What is your diagnosis, Dr. Espada?
I'm so glad you asked, Dr. Davish. Our current differentials for his clinical signs are pelvic flexure impaction, iliac impaction, and sand colic. Pelvic flexure impaction is most likely, since we palpated a firm mass in the left dorsal quadrant of the abdomen. The dilated loops of small intestine are most likely due to compression from the large colon.
I concur. However, doesn't he eat coastal Bermuda hay on sand?
Good point, Dr. Davish. We ruled out sand colic when we filled our rectal sleeve with fecal balls, filled it with water, and waited for sand to sediment.
Did you listen for the ocean?
This is garbage. You can only hear the ocean in seashells.
What about an iliac impaction?
It could be possible, but the impaction we felt was in the area of the pelvic flexure.
How will you medically manage this patient?
We have given him 10 cc's of Anamine IV to help with his pain. He has an indwelling NG tube in order to give him oral fluids every 3 hours at 2 times the maintenance rate. We will hand walk him for 15 minutes every 6 hours, keep him NPO until he passes feces, and give him 1 gallon of mineral oil. Hello. You don't say. Like a hummingbird? Faster than a speeding bullet? Down and rolling? Oh really?
What is going on now? Do I get to go to surgery?
Yes, it seems the gypsy vanner is not responding to our medical therapy, and is getting worse.
Let's get this party started. I will have the surgery suite set up, make sure my party mix is loaded in Pandora, and I will call Silver Fox, the Canadian, and Basley for backup.
That sounds great. Can I help? I'm very handy with a staple gun.
Thank you for the offer, but no.